Hello, everyone. So I'm a hardcore clinician, so most of this is like pretty Greek to me. So I'm really appreciative of everything this school is offering. I am a nurse practitioner specialized in psychiatry, and I work with really, really sick patients. When I say sick patients, these are patients who cannot make a decision on if they want treatment or not. Mostly they do not take treatment, so what we do is we petition them, and the judge determines that, decides that the patient should undergo treatment, and they get committed. But when we talk about schizophrenia, most people know schizophrenia from movies or from a friend per se. And what do we know about schizophrenia? Like the common symptoms that we really know, like the bizarre hallucinations, hearing voices, seeing things, everyone knows. Most people have seen The Beautiful Mind, and Russell Crowe has actually beautifully portrayed the bizarre hallucinations. But what is not shown is the other symptom clusters, like the negative symptoms and the cognitive symptoms. So there's a whole array of symptoms which are affected. And on top of it, not one schizophrenic patient looks the same as another patient. It's a very heterogeneous disorder. So we commonly refer to it as the schizophrenias because clinically it's actually an array of a cluster of symptoms, and genetically also it's pretty complex. So what is insight? Now, patients who are sick, they don't really think they are sick. And this change in their awareness is called as impaired insight. And it's pretty complex. This is a question, this is one of the fundamental problems in patients who have schizophrenia, and we've been trying to answer this for the last 150 years. We don't have a grip on it. Patients who don't recognize that they are sick, they don't take medication. I mean, if I'm not sick, no one in this world is going to make me take medication, right? And we cannot help the patients engage in therapy. But patients also are not able to correctly attribute symptoms, and they don't think they need treatment. So if you talk to the family, they will tell you, if only he would take treatment, but the patient is not going to take treatment. And that is also called as anosognosia, because you see this in other conditions like frontotemporal dementia, as well as bipolar disorder in the manic states. So it's not just specifically to schizophrenia. So when we look at the studies that they do, they look at schizophrenia diagnosis per se, but what we have to look at is the symptoms, though. So that's the approach I was trying to do. And what did the literature say? So a simple biological pathway, genes encode for proteins, and they become the cellular machinery and function, neural circuits, and we have the symptom. Very little. If you look at the neural circuitry, pretty much all the brain regions are involved in insight. It's the entire brain. Now, what am I going to do with that? So what I tried to do is look at how it's related to other symptoms as well as the genetic basis. Thank you.